Okay, let's unpack this. Imagine a highly skilled surgeon performing delicate, life-saving work.
Hmm.
You might think about their steady hands, their years of training, the precision tools, maybe even the advanced tech. But what's the one thing you might not consider crucial, yet without which the entire operation could falter, or, even worse, put a patient at risk? It's not another scalpel or some new medication, it's their eyes. Or rather, your eyes, if you're the one standing there holding the camera.
That's exactly right. In the intricate, often high-pressure world of laparoscopic surgery, the surgeon's entire visual field is, well, completely mediated by another person, the cameraman.
Uh-huh.
So this deep dive is going to illuminate that critical, often unsung role. We'll explore why this isn't just a technical task, a simple point-and-shoot job.
Right.
It's actually a highly skilled art form directly impacting patient safety, surgical efficiency, and ultimately patient outcomes.
We've got a fascinating stack of sources today. They lay out these golden rules of camera zoom, and they really delve into the unique challenges of maintaining a perfect view. Plus, they map out the indispensable duties of what's essentially the surgeon's second pair of eyes.
Exactly.
So our mission today is to pull back the curtain on this absolutely vital position. We want to help you understand the nuance, the precision, and honestly, the immense responsibility involved in this partnership. You'll probably be surprised at how complex, seemingly simple camera movements can be, and how much really rides on the cameraman's silent expertise. So let's start with what our sources highlight as the fundamental principle here. In laparoscopic surgery, the surgeon's vision is completely dependent on the cameraman. That immediately tells you we're not talking about some passive assistant just holding equipment, are we?
No.
This isn't someone who could just zone out.
Absolutely not. This is arguably the most profound difference from traditional open surgery.
Right, open surgery where they can just see directly.
Exactly. Where the surgeon has direct, unmediated vision, able to look directly at the operative field with their own eyes, use their peripheral vision, even shift their posture for a different angle.
Uh-huh.
In laparoscopy, however, there's a series of technological layers between the surgeon and the anatomy. Every single thing the surgeon sees, the tissue they need to work on, the instruments they are holding, the specific target anatomy they're trying to dissect, it's all funneled through a tiny lens at the end of a laparoscope,
Wow.
which is then held and manipulated by another person. This transforms the cameraman from, a mere helper into the surgeon's literal second pair of eyes.
That's like a pair of eyes, yeah.
They aren't just a passive operator. They become an active, critical participant in every decision and every movement the surgeon makes. They're translating the complex, three-dimensional reality of the patient's internal anatomy into a two-dimensional image on a screen.
That complete dependence you mentioned, it sounds like it would fundamentally alter the entire dynamic in the operating room.
Oh, it does.
What are the deeper implications of this reliance? I mean, the surgeon really can't just look for themselves.
The implications are enormous. It fundamentally shifts the cognitive and physical dynamic in the operating room. The surgeon cannot simply look themselves. Their visual field, their entire operative world, is entirely at the mercy of the cameraman's skill, their attentiveness, their anticipation.
Right.
Think about it this way. Imagine trying to perform a highly delicate task, like assembling a tiny, intricate model while blindfolded.
Okay.
Now imagine someone else is holding a camera, and you can only see what they choose to show you on a screen.
That sounds incredibly frustrating.
Exactly. You have to guide your hands, your tools, your entire physical action based only on that mediated image. The cameraman in laparoscopy isn't merely describing what they see. They are actively constructing the surgeon's immediate visual reality, moment by moment.
Actively constructing. I like that phrasing.
Their ability to frame, focus, and stabilize that image directly dictates the surgeon's capacity to operate effectively, efficiently, and safely. If the camera moves unexpectedly, the surgeon's world literally shifts, forcing a mental reorientation mid-action. This constant reliance creates a unique bond, a silent conversation, and an immense need for trust and synchronicity within the surgical team.
So their skill directly correlates to the safety and success of the procedure. That's a pretty high-stakes connection. But does this dependence ever create tension in the operating room? How does that dynamic, that need for perfect trust, play out when there are potentially life or death consequences?
That's a crucial question, and it speaks to the immense psychological pressure in the OR. Precisely. The steadiness of the cameraman's hand, their keen anticipation of the surgeon's next move, and their overall awareness of the entire surgical field directly affect not just the efficiency, but critically the safety of the whole operation.
Safety first.
Always. Any misstep, even a slight tremor, a momentary disorientation caused by the camera's movement, or an ill-timed zoom, well, it can lead to significant frustration for the surgeon.
I can imagine.
And this frustration isn't just about annoyance. It translates into delays in time-sensitive procedures, increased mental fatigue for the surgeon, and most critically, a heightened risk of surgical errors. Imagine a surgeon trying to clip a vital vessel, but the image is constantly moving, or they can't see the full path of their instrument.
Yeah, that's terrifying.
That's a recipe for disaster. In this role, precision isn't merely a preference or a desired trait. It's an absolute, non-negotiable requirement for ensuring patient safety. The visual pathway is the surgical pathway in laparoscopy, and any compromise to that pathway can directly compromise the patient. Building that trust is paramount, and it often comes through consistent training and experience together, almost like a form of nonverbal communication where the surgeon can anticipate the camera's move and vice versa.
A nonverbal communication, yeah, a dance.
Something like that.
Okay, so with that fundamental dependence in mind, our first source lays out 5 golden rules for laparoscopic camera zoom. And these aren't just suggestions. They're described as fundamental principles, almost commandments, for effective camera work.
That's right.
Let's dive into what makes each of these so crucial for the cameraman and, by extension, for the surgeon.
Okay. These rules essentially codify the visual strategy for different phases of a laparoscopic procedure. They provide a clear, actionable framework for how the cameraman should manage the visual field. They guide the cameraman on how to best frame the surgical field and adjust magnification to empower the surgeon to perform optimally.
So it's like choreographing the view.
Exactly. Think of it as choreographing the view, where every camera movement, every adjustment of zoom or angle is a deliberate step designed to optimize the surgeon's perception and facilitate their actions. These aren't arbitrary guidelines. They're distilled from extensive experience born out of countless hours in the operating room, understanding what makes for effective and, above all, safe laparoscopic surgery. Mastering these rules is really a hallmark of a truly skilled cameraman.
The first rule, then. Zoom in for fine work. Our sources specifically mention critical steps like the meticulous dissection of callus triangle or the skeletonization of ducts and arteries. Why is this close-up, magnified view so vital for these incredibly specific, delicate tasks? And what happens if you don't zoom in enough?
Well, these are indeed moments of extreme precision, where the margin for error is incredibly small. We're talking millimeters here. Callus triangle, for instance. It's a small, anatomically complex area, particularly critical during a cholecystectomy gallbladder removal. Within this tiny region lie vital structures. The cystic duct, the artery, the common bile duct, they all need to be meticulously identified, separated, and then safely secured or divided.
Okay.
Mistaking one structure for another, well, it can have catastrophic consequences, like inadvertently cutting the common bile duct, leading to severe complications.
Yeah, definitely want to avoid that.
The source emphasizes clarity plus magnification as the undeniable key here. A magnified view allows the surgeon to distinguish tiny vessels, delicate nerve endings, the precise tissue planes they need to follow. It's like a cartographer zooming in on a highly complex intersection on a map. At that level of detail, every line, every subtle change in texture or color becomes crucial for navigation.
Okay, yeah, that makes sense.
A wider, less magnified view in such a situation would obscure these vital details, making the surgeon's job exponentially harder and significantly increasing the risk of accidental injury. You simply can't afford to miss a critical vessel or nerve.
And what about tremor? Doesn't zooming in make shakes look worse?
That's a great point. Yes, magnification inherently amplifies any actual tremor, making a small handshake look like a large wobble on screen. But the benefit of enhanced clarity for identifying critical structures usually outweighs this. The surgeon, seeing the magnified detail, can make more precise micro-movements, even if the image appears to oscillate more.
Interesting trade-off.
It is. You get a slightly less stable appearance, but dramatically improved information that enables safer dissection. The visual information gained is too vital to skip during these critical phases. And a skilled cameraman learns to compensate for that visual amplification of tremor through bracing techniques, which we'll probably get to later.
Got it. Conversely, Rule 2 advises to zoom out for overview, pulling the camera back slightly during steps like clipping, retrieval of specimens, or when the surgeon needs to reorient. Why is it so important to pull back and see a wider scene at these points, especially after focusing so intensely?
This rule is all about avoiding tunnel vision and maintaining crucial situational awareness.
Okay.
When you're doing actions like clipping a vessel, retrieving a specimen, or even just needing to reorient after a focused task, the surgeon needs to understand their position within the larger anatomical context. The benefit here, as our source explicitly points out, is that both instruments and target stay visible.
Right, seeing the whole picture.
Exactly. Let's imagine you're too zoomed in during clipping. You might clearly see the clip applicator tip and the vessel, which is good, but critically, you might lose sight of the path the clip is taking, or worse, other adjacent structures it might inadvertently touch or damage.
Ah, okay. Collateral damage.
Precisely. A wider view ensures the surgeon has a panoramic understanding of the immediate surgical landscape. It prevents accidental damage to nearby organs or tissues that are just outside a tightly zoomed frame. It's like that pilot landing a plane analogy.
Oh.
They need the detailed view of the runway, absolutely. But they also need awareness of the broader airport environment, the approach path, other traffic, all of it. This wider perspective helps the surgeon confirm spatial relationships, plan next steps safely, and reduces the risk of overlooking something critical just outside the narrow field of view. It's seeing the forest, not just the trees, at the right moments.
Makes perfect sense. Okay, rule 3. This one seems intuitive, but our sources stress its immense importance. Never show only the target surgeon must see their own hands or, well, the tips of their instruments. What's the psychological, the physiological importance of this? What actually happens when this rule gets broken?
This rule speaks to fundamental aspects of human motor control and proprioception, our body's ability to sense its position and movement. Surgeons, like anyone doing a fine manual task, rely heavily on seeing their hands, or in this case, the instrument tips in continuous relation to the target they're manipulating. Without seeing both the instrument tips and the target, it's like trying to thread a needle while only looking at the thread, or only at the eye of the needle, but never both simultaneously.
Yeah, impossible.
Pretty much. The visual feedback of the instruments interacting with tissue is absolutely crucial for maintaining precision, accurately perceiving depth in a 2D image, which is already a challenge, and preventing accidental slips or damage. Our brains need that visual confirmation.
So what are the consequences when it's violated, when they can't see their instruments?
The consequences are immediate and detrimental. You often see increased frustration from the surgeon. They struggle to orient themselves.
I bet.
There are more frequent pauses as the surgeon tries to reestablish their bearings, often verbally guiding the cameraman to adjust the view. This breaks the crucial flow of the surgery and significantly increases the risk of errors because they lack that immediate critical feedback loop.
Yeah, breaks the flow.
And one could even speculate that repeated violations might lead to a loss of surgeon confidence in their cameraman, creating a subtle but impactful rift in team cohesion. It forces the surgeon to rely on a less intuitive, more mentally taxing mode of operation, essentially guessing at their precise instrument tip location. This added cognitive load can lead to rapid mental fatigue, increasing the chance of errors, especially in long procedures.
Wow. Okay. So it's really fundamental.
Absolutely.
Rule 4 sounds deceptively simple. Move slow, stay steady, advance gently without jerks, brace the hand against the abdominal wall. Why is slow and steady so paramount? This seems like it gets right to the heart of the cameraman's physical challenge.
You're absolutely right. It's deceptively simple, yet incredibly challenging, and it directly addresses one of the biggest, most frustrating issues in laparoscopic imaging.
Oscillation.
Oscillation, right. We'll get more into that later. We will. But even minute, almost imperceptible movements by the cameraman get significantly magnified on that large display screen the surgeon's watching. A gentle, slow advance, specifically without jerks, is critical because sudden, abrupt movements can disorient the surgeon instantly. Imagine the visual field suddenly lurching sideways.
Yeah, makes precision impossible for a moment.
Exactly. The instruction to brace the hand against the abdominal wall is a practical, almost instinctive technique that vastly improves image stability. By resting their hand on a stable surface, like the patient's abdomen or the trocar port, the cameraman effectively reduces inherent physiological tremor.
Like using a tripod.
Precisely. Our sources also mention a teaching pearl, reinforcing this. Close and steady for dissection, emphasizing the non-negotiable importance of stability during the most delicate tasks. A steady, unmoving view isn't just a nicety. It critically reduces surgeon fatigue, minimizes frustration, and, most importantly, allows for consistent, precise movements. That's the bedrock of safe surgery.
It's like trying to write your name while someone's jiggling the paper.
Exactly that. The quality plummets. The surgeon experiences a similar, maybe even more intense challenge if the camera isn't rock steady. This constant visual instability forces the surgeon's eyes and brain to work overtime just to track the field, diverting mental resources away from the main surgical task.
Increases risk, increases fatigue. Got it.
Right.
Finally, Rule 5. Use the 30 degrees wisely. This involves rotating the scope to look around corners and, crucially, keeping the horizon straight, unless specifically asked for a tilt. What exactly does that 30-degree angled scope offer? And why is maintaining a straight horizon so incredibly important? It's a golden rule.
The 30-degree angled laparoscope is a remarkably clever tool. It provides a crucial, almost tactical advantage, often described as the ability to look around corners.
Look around corners.
Okay. Unlike a 0-degree scope, which gives a straight-ahead view, this angled view lets the surgeon visualize areas that would otherwise be completely obscured by surrounding anatomy, say, the liver or bowel, or even by their own instruments. It's like having a periscope that can peer behind things, offering a broader, safer view without needing to constantly reposition the patient or instruments. Invaluable for spotting hidden structures.
Okay, sounds very useful. But there's a catch.
There is. With this flexibility comes immense responsibility for the cameraman. Keeping the horizon straight is absolutely critical for maintaining the surgeon's spatial orientation in that magnified 2D field on the screen.
Why is the horizon so important?
Any tilt, even a slight one, can cause severe disorientation. Our brains are hardwired for a stable visual horizon. It's fundamental to how we make sense of our surroundings. In a 2D magnified view, losing that stable horizon makes it incredibly difficult for the surgeon to differentiate up from down, left from right, or to accurately perceive depth. Imagine trying to park a car if the world on your windshield was constantly tilting.
Yeah, my spatial judgment would be shot.
Exactly. In a high-stress, high-precision environment where every millimeter counts, such disorientation can profoundly impact the surgeon's motor skills, their spatial judgments, their decision-making, potentially leading to critical errors, like dissecting in the wrong plane, cutting the wrong structure, misplacing a suture. It's about leveraging a powerful tool's advantage without introducing visual confusion that undermines the surgeon's ability to operate safely and confidently. The cameraman acts as the surgeon's internal GPS, providing that stable map.
Internal GPS. I like that.
Ah.
Okay, so while those 5 golden rules of zoom are clearly critical for precision and safety, our sources make it abundantly clear that the cameraman's responsibilities extend much further. It's not just framing the shot and zooming. What are some of these broader, comprehensive duties that really define their active, indispensable role?
Indeed. Beyond just framing and zooming, the cameraman is responsible for the entire visual environment presented to the surgeon. It's a truly multifaceted role needing constant vigilance, active anticipation, proactive action. Our sources outline several key general duties that illustrate this. They move far beyond mere technical operation of the camera to a deeper, more integrated partnership. These duties highlight that the cameraman is continuously managing dynamic variables that directly impact the surgeon's ability to see and perform. They're not just reacting, they're strategizing and problem-solving in real time.
First up, and this seems like a no-brainer, but with massive consequences, maintain a clear view. We've all had a smudged camera lens on our phone or a dirty car windshield. In surgery, this is a much, much bigger deal, isn't it? What's involved?
Significantly so. The stakes are astronomically higher. A soiled or fogged laparoscope lens in surgery. It's like trying to drive in dense fog or worse through a windshield covered in mud.
Yeah, totally blind.
Exactly. The surgeon's entire world becomes instantly obscured and they are effectively operating blind. This is simply unacceptable when performing delicate procedures where even seconds of obscured vision can lead to critical errors or dangerous delays.
Then what do they do?
The cameraman has an explicit and immediate duty to keep that lens clean and defogged. This isn't just wiping it. It often involves specialized techniques, like dipping the scope in warm saline before insertion or using anti-fog solutions. And the instruction is unequivocal. Withdraw and wipe immediately if the lens gets soiled. Immediately. This means a quick, precise withdrawal, a swift cleaning with a sterile sponge, immediate reinsertion, all while minimizing disruption and maintaining sterility. Any obstruction, blood, tissue fragments, condensation must be rectified instantaneously. This requires constant awareness, almost subconsciously checking the image clarity and rapid, decisive action, often under time pressure. It's fundamental.
Constant vigilance.
Yes.
Next, follow the surgeon's instruments, anticipating where the tip will move, adjusting smoothly, always keeping both instruments and target in frame. This sounds like that incredibly dynamic, almost anticipatory ballet again. How do they actually achieve that kind of prediction?
It absolutely is, and ballet is a perfect analogy. This is where the cameraman truly becomes an extension of the surgeon's will, showing a high level of intuition and surgical understanding.
More than just technical skill.
Much more. It requires not just passive observation, but active, almost psychic anticipation of the surgeon's next move. The cameraman needs to read the surgeon's hand movements, interpret their body language, a subtle shift in posture, a lean, and possess a deep understanding of the surgical flow.
They need to know the procedure inside out.
Exactly. Know the anatomy, the steps, what the surgeon is trying to achieve at any given moment. This allows them to adjust the camera smoothly, often leading the instruments rather than just following, ensuring the instruments are always optimally viewed in relation to the target tissue. It's a continuous, synchronized movement. Perfect sync is the goal.
What if they don't anticipate?
Then the surgeon is constantly waiting for the camera to catch up. That leads to frustration, delays, a broken surgical flow. This duty strongly reinforces that keep both instruments in frame rule, but frames it as this ongoing dynamic, critically anticipatory responsibility. It demands a flow state from the cameraman, too.
Flow state. Interesting. We touched on this with the 30-degree scope, but reiterating, maintain horizon and orientation as a general duty seems crucial. Keeping the image upright, level, adjusting zoom based on the stage of surgery. Why is orientation so profoundly central? What are the deep consequences when it's lost?
As we discussed, tilting the visual field causes profound disorientation. It's so critical, it's a general principle, not just for the 30-degree scope. Our brains are hardwired for a stable visual horizon. It's fundamental to how we perceive space, depth, navigate our environment. Think about walking across a room if the floor and ceiling were tilting.
You'd lose your balance, feel dizzy.
Right. In a magnified 2D laparoscopic view, losing that stable, upright horizon severely impairs the surgeon's ability to accurately perceive depth, differentiate direction, understand spatial relationships. It's like trying to navigate using a compass that constantly spins randomly while also doing delicate work.
Neurologically disruptive, you said.
It is. The surgeon's hand-eye coordination, already working in a mediated, often counterintuitive environment, breaks down. They can misjudge distances, make incorrect turns with instruments, struggle to target structures accurately. This leads to hesitation, increased operating time, dramatically increased risk of error. The stability and consistent orientation provided by the cameraman are fundamental. Without a reliable sense of up and down, the surgeon's mental map collapses, makes safe surgery nearly impossible. It's the silent anchor.
The silent anchor for their perception. Yeah. Illumination is also key. Ensure the light source is directed properly without glare and avoid shadowing the dissection plane. Seems obvious, but what's the art to perfect lighting here? How can it go wrong?
It's a surprisingly delicate balance, and yes, an art form that often goes unnoticed until it's done poorly. The goal is optimal visualization, the right amount of light, directed precisely where needed.
Right.
Too much direct light or light angled improperly can cause blinding glare, like a spotlight in your eyes.
Washes everything out.
Exactly. Obscures critical details, hides edges, small bleeders. Conversely, insufficient or improperly directed light can cast shadows that hide vital structures, a vessel, a nerve, a duct, leading to accidental injury because the surgeon just can't see it.
So it's a constant adjustment.
Constant. The cameraman must subtly rotate the scope, adjust light intensity, understand how different tissues reflect light. A vascular area needs care to prevent glare from blood. Identifying a nerve needs focused, shadow-free light. Think of a professional photographer. Lighting is everything. It shapes what you see, reveals or obscures details. The cameraman is painting the scene with light.
Painting the scene. Nice.
Missteps here can lead to costly delays or overlooked structures, resulting in patient harm.
Our sources talk about coordinate movements, slow, fluid movements, avoiding sudden jerks, moving in harmony with the surgeon's dominant hand. This sounds again like that partnership, that choreographed duet, anticipating every move.
It absolutely is a partnership demanding high synchronicity, like dancers. Sudden, jerky movements are incredibly disruptive. They break concentration, make fine motor tasks virtually impossible, induce significant frustration. Imagine trying to write a complex equation and someone keeps jiggling the desk.
You'd lose your train of thought, make mistakes.
Exactly. So the cameraman's movements must be slow and fluid, almost an extension of the surgeon's own hand and intent. Moving in harmony with the surgeon's dominant hand implies that intuitive understanding from training and experience working together. A skilled cameraman gently leads the instrument, predicting where it's going rather than lagging.
Creating a seamless visual experience.
That's the goal. So the camera's movements are so integrated and smooth, the surgeon barely perceives them as separate, allows the surgeon to maintain focus, enter that flow state.
And if movements aren't coordinated?
The surgeon might pause, verbally direct the camera, even withdraw instruments and restart. All adds precious minutes, increases anesthesia time, raises risks. The ideal is that silent, almost telepathic synchronicity.
Telepathic synchronicity. Wow. Finally, our sources emphasize communication, responding promptly to verbal and nonverbal cues, maintaining situational awareness. This brings us squarely back to the human element, doesn't it? Beyond all the tech, it's about being deeply connected to the team.
Indeed it does. And this is where all the technical proficiency meets the human dynamics of a high-performance team. The OR is incredibly dynamic, high stress, effective communication, explicit and implicit is its lifeblood.
Implicit communication, too.
Absolutely. The cameraman needs to be not just technically proficient, but also an astute observer and listener. Respond promptly to verbal commands, zoom in, pan left, wipe the scope. Yes, but also interpret subtle nonverbal cues.
Like what?
A slight shift in the surgeon's posture, a change in movement rhythm slowing down dramatically often means a critical moment. Even breathing patterns can indicate a need for adjustment.
Fascinating.
Furthermore, maintaining situational awareness of the case progress means understanding where they are in the procedure, the next steps, what the surgeon is trying to achieve. For example, if the surgeon's about to ligate a vessel, the cameraman needs to know to zoom out slightly to show the instrument and surroundings, anticipating the clipping. This comprehensive awareness allows for proactive, not just reactive, camera control, anticipating needs before they're verbalized.
A continuous feedback loop.
Exactly.
Yeah.
Blending verbal, nonverbal communication with shared understanding. It's vital for efficiency and safety. Miscommunication or lack of awareness can lead to delays, frustration, critical errors, underscores the cameraman as a vital thinking team member.
Okay, let's turn to a major challenge that can seriously impact a surgeon's ability to perform precise work: laparoscopic oscillation. Our sources highlight this as unique and persistent in this kind of surgery. It sounds like an invisible enemy constantly threatening the view. What exactly is happening here? What makes it such a problem?
Invisible enemy is a perfect description. Laparoscopic oscillation refers to unwanted, often subtle camera movements, and it's critical because of how the whole system works. Even the smallest tremor or instability from the cameraman's hand or the equipment gets significantly amplified on that big screen the surgeon's watching.
Amplified. Okay.
This isn't just an annoyance, it's a constant battle against visual instability. Our sources describe two main forms of this oscillation that can severely impede precision and focus. It's inherent to the mediated vision system, and overcoming it takes immense discipline.
So microtremor amplification means even a tiny, almost imperceptible handshake from the cameraman becomes a big, distracting, potentially dangerous wobble on screen. How does that impact the surgeon's focus and, I guess, their confidence?
Exactly. The source clearly states, a small handshake at the camera handle translates into large oscillations on screen. This makes incredibly fine dissection, like cystic duct artery skeletonization, extremely difficult. Imagine trying to dissect those delicate structures, distinguish tiny vessels, with the image constantly jiggling and blurring.
Like drawing a straight line on vibrating paper.
Precisely. The surgeon is forced to operate on a moving target, requiring exponential mental effort to filter out the noise and focus. And this challenge is compounded by the surgeon's perception. Because laparoscopy inherently magnifies the field, any oscillations, however minute in reality, look much larger than they are on screen.
So it feels worse than it is.
It feels much worse. This creates immense frustration and errors. It's not just physical difficulty, it has profound psychological impacts. The surgeon is trying to perform these delicate tasks with a constantly moving target, feeling amplified instability. It can make them doubt their skills, or worse, their cameraman's competency. This constant struggle leads to rapid mental fatigue, forces more frequent pauses, significantly increases cognitive load, diverting resources from critical decision-making. One study even suggested it increases surgeon stress hormones. It's a silent, draining battle.
Stress hormones. Wow. Okay. And then there's the pendulum effect. What exactly is that? How does it add to the challenge?
The pendulum effect refers to a subtle, continuous swinging motion of the scoop itself, often due to equipment factors, not just human tremor.
Equipment factors.
Yeah. Our sources note that overlong or poorly fixed scope cables can cause slight swinging of the laparoscope. While it might seem minor, this constant subtle movement creates a seasick or unsteady view for the surgeon. Not a sharp jiggle, but a continuous, disorienting sway.
Seasick. That sounds awful while trying to operate.
It is. It's genuinely disorienting and fatiguing. Imagine trying to concentrate intently on fine print while on a gently swaying boat. One surgeon described it as trying to perform microsurgery while seasick. That puts it into perspective.
Definitely.
This sustained visual instability impacts focus over long periods, makes accurate movements difficult, potentially inducing nausea, headaches, eye strain. When a surgeon battles both magnified hand tremor and a subtle pendulum swing, the cognitive load becomes immense. It's processing a constantly shifting, disorienting image. Leads to rapid fatigue and increased error risk over a long surgery. It's a compound challenge.
Given how absolutely critical stability is, what are the specific control measures cameramen use to combat these pervasive oscillations? Sounds like it needs immense discipline and specific techniques.
It does. The sources give clear, practical strategies showing the immense physical and mental discipline required. The primary, most direct measure, which we touched on, is to brace the scope hand against the patient's abdominal wall or trocar.
Right, the physical bracing.
Physically stabilizing the hand by resting it firmly on a stable surface significantly reduces tremor transmission, like using a tripod. The cameraman might even lean into the patient using body weight for steadiness.
Okay, what else?
Beyond that manual technique, if available, they should use the camera holder support system. These are tech aids, robotic or mechanical arms designed for mechanical stability, eliminating human tremor entirely.
Ah, robotic assistance.
Right. Not always available or suitable, but they offer a sterile, rock-steady view when used. And interestingly, there's a more subtle physiological technique highlighted. The cameraman should consciously breathe shallow and move minimally when the scope is held steady for delicate work.
Breathe shallow, really?
Yeah. Yes, it's fascinating. Shows the extreme focus and mental discipline needed to minimize even involuntary body movements like deep breaths, causing subtle chest movements during critical phases. This really underscores how ingrained that move slow, stay steady rule and the close and steady for dissection pearl are. Training must include technical skill, physical bracing, understanding equipment, and profound mental discipline for that unwavering visual pathway. It's a testament to human adaptability for incredible precision.
Incredibly disciplined.
Yeah.
So to bring this all together, our deep dive has truly shown us that the laparoscopic cameraman is far, far from a passive assistant. They are an active, indispensable, utterly critical partner in the operating room. What's the ultimate takeaway for you about the breadth and depth of their role?
The core insight from our sources, for me, is that the cameraman is truly the surgeon's second pair of eyes. And that phrase captures so much more than the literal description. Their role isn't just holding equipment. It's defined by an essential, complex blend of steadiness, anticipation, and awareness.
Steadiness, anticipation, awareness.
Right. They have to combine acute technical skills with a deep, almost intuitive knowledge of the surgical flow, anticipating needs often before they're voiced. This dynamic synergy lets them create and maintain the optimal visual field needed for safe, successful surgery. This isn't merely pointing a camera, it's actively guiding the surgeon's perception, helping them navigate a complex internal landscape, facilitating every precise movement. It's a role demanding constant learning, adaptation, and that almost telepathic synchronization with the surgeon and the whole team.
That's a powerful way to put it. Telepathic synchronization. And it highlights the blend of skills, not just physical dexterity, but mental acuity and interpersonal connection too, isn't it?
Absolutely. To expand on that, it's a role requiring an extraordinary blend. Physical dexterity for a steady hand under pressure, mental acuity to anticipate and react, and interpersonal synchronization to work seamlessly, silently. The hidden expertise of the cameraman, often unseen and unacknowledged by the patient, directly impacts the quality of healthcare someone receives.
Hidden expertise. Yeah.
Their skill transforms a challenging mediated view into a clear, stable, orienting picture, allowing the surgeon to perform at their best, minimizing fatigue, maximizing precision. Without this precise, dedicated, highly skilled role, the immense benefits of minimally invasive laparoscopic surgery, smaller incisions, faster recovery, less pain would be significantly diminished. Their invisible actions contribute directly to tangible patient benefits. Unsung heroes in every sense.
Unsung heroes. Definitely. Hashtag tag, tags, tag, outro. What an incredible deep dive into a role that is so vital, yet often completely invisible to the outside world. We've explored the golden rules of camera control, the comprehensive duties far beyond just holding the camera, and the subtle but critical challenge of oscillation and how it's managed. All of this reinforces just how pivotal the laparoscopic cameraman is to surgical success, surgical safety, and ultimately to the well-being of every single patient.
Indeed. It highlights how seemingly small supporting roles in complex, high-stakes environments can actually carry immense responsibility and require extraordinary, often undervalued, skill. The surgeon's mastery is not a solo act. It's amplified or unfortunately diminished by the quality of the visual pathway provided by the cameraman. It truly emphasizes that no operation is a solo act. The success of complex systems often hinges on the precise, dedicated performance of every team member, especially those operating behind the lens.
So for you, our listener, here's something to ponder. In your own field, or in other complex systems you encounter, maybe a well-oiled business team, an artistic collaboration, even a simple family dynamic, what are the invisible or supporting roles that are actually the unsung heroes, whose precision, steadiness, and awareness are absolutely critical to the success of the whole, but whose profound impact we often overlook until something goes wrong? Something to think about. Until next time.